Hello, everybody. I'm here today with Dr. Veneeth Sidhartan from India, from Kerala. So, hello, Dr. Veneeth.
Hi, Rene.
Hi. So, I first heard of you from a homeopath in the Netherlands, Carolina, and she was very enthusiastic about you because she went to India and visited your practice. And I saw you a few years ago here doing in a small group, a kind of workshop, very active the seminar, and I was also enthusiastic. So, Dr. Veneeth, can you tell me something about your practice in India? What kind of practice is that? Is that in a hospital or a private clinic? And is that only acute cases, or can you tell us something about this?
Yeah. So I just wanted to mention the homeopathic system in India, because here in India we are having a cabinet ministry for homeopathy. So we are having a big system of homeopathic teaching here. Regarding the university level, we are having undergraduate course, a postgraduate course, and even the PhD course also. PhD in homeopathy. So it's a very regular classes. It's like we are studying for 5.5 years to be entitled as a doctor. We are studying everything from the modern medicine aspect also. We are studying the pathology, the biochemistry, the pharmacology, surgery, gynecology, everything, along with the homeopathic subjects also. So when we are coming out after 5.5 years, we are entitled as doctors because we are having the experience with all systems of the modern medicines also, along with homeopathy. So I am doing is like that. I have 3 clinics here, in which I am having inpatients and outpatients. You know, the patients we are treating, we are having the patients who are having the chronic diseases like the cancers and the chronic renal failures. We are admitting them and we are looking after them. So every sort of patients we are looking every day. Like I'm having like more than 70 patients a day. Yeah, it's common in India because we are having more than 1.5 billion. Why 1.5 billion people? That's why. And in Kerala, it's like more than 3 not 3 million, it's 30 million. 30 million people in Kerala. So it's bigger country and we have a lot of patients. And the people are using that. We have a government institution all around in Kerala. It's like more than 1,000 government dispensaries and more than 6 medical colleges teaching homeopathy only, and a lot of homeopathic hospitals also. So it's a well-established system in India and especially in Kerala. Yeah.
Yeah, because what I found interesting from your seminar day here is that from the cases you presented, I saw some you were in very close cooperation with a regular medicine system. There was not a competition here in where I am in the Netherlands, in Europe. The homeopathists often looked down on, or still, or in some countries even forbidden. So that was very nice to see this close interaction. You could refer your patient for a checkup to the hospital, or some regular doctors send it back to refer cases to you.
Yeah. Yeah, the reason for that is because of the government is taking a good part in that, because we have a lot of government owned dispensaries here. So if government is taking over the system, normally the people will accept that. So that's why the systems are, even though there are some sort of problems, some sort of things between the modern medicine and homeopathy, most of the people, they know homeopathy well, because even though the modern medicine doctors, they have been used homeopathy when they were in the childhood. So they know very well. That's because it's very popular here. According to our statistics, only the homeopathic dispensaries run by government. More than 10 million people are using homeopathy in Kerala, the state, only a state in India.
Yeah,
10
yeah.
million in only the government. And if you consider the private practitioners, it will be like more than 20 million. So it's a big thing, huh? Every day, not in a month or a week like that. It's every day. Yeah. So
So
it's popular there.
yeah. So and I am in this homeopathic world already a long time. When I studied initially, I found it quite overwhelming, and it and I visited the first time some seminar, I think, from Bill Gray and then Jonathan Shore, and it was initially Polycrest. Then we had teachers here coming who were teaching smaller remedies. Then I remember a few years later, there were smaller remedies, and then all kinds of new methods are starting. And I wonder sometimes if I would today be a new student today, that I would be completely confused. So, what kind of homeopathy is that? What in Kerala is being taught and practiced by most people?
Yeah, I believe that homeopathy is invented by Hahnemann. So he has put forward a beautiful method how to tackle the disease, like the similia similibus curanta. So whatever diseases you are having, the only thing you have to look after is similia similibus curanta. So the problem regarding homeopathy, it's my thought. It's like homeopathy, even though homeopathy originated in Europe, why it's been degraded? There are so many reasons. Like the people always say, because I am having a lot of groups in Europe. I used to take classes in Spain, in Greece, Germany, and in United Kingdom, and even in the Netherlands also. The problem is like that. The people are they're forgetting the basic principles of the homeopathy, because homeopathy nowadays it's like a Pandora's box. A lot of systems are there. I'm to the all. I'm not degrading any masters. I'm not against any masters. I usually follows everyone.
Mhm.
But the thing is, the Hahnemann invented homeopathy, and he clearly pursues. He he was doing his practice very nicely. At that time, he thought that it's not good, and he closed his clinic for 12 years for writing the chronic disease. That much pain he at that much pain he took for writing all these things. So the problem is like that. It's like a catalog. You know, every product in the world, every product when it is released, they have got a catalog. So for homeopathy also, there is a catalog. The catalog is organon of medicine and chronic diseases. If you read the catalog very nicely and if you perceive that thing, you could able to practice that very easily. When you are behind all the new things, new masters and all, the problem is like that you are forgetting the principles formulated by the Hahnemann. That's a problem, I believe. That's why only the reason, because the homeopathy is being degraded in the Europe and the West. But in India, the thing is like that we are learning everything regarding homeopathy, because it's an extensive course for 5.5 years. So we have a lot of opportunity to learn all the masters. The thing is like this: we have to be uh, clear regarding the basic principles of homeopathy. Otherwise, you can't able to practice that. And I believe in a system which could be replicated. I have a lot of students which they have just completed the course and they will come and sit in my clinic. And from the Europe also, I have a lot of students like from Spain and Greece and Germany. They are coming here and they are sitting in my clinic for 2 weeks or something like that, and they're seeing a lot of patients. So they're getting confidence. So for every diseases, from the acute cases, like from the skin eruptions, from the fever to the chronic, the cancers, the fourth grade cancers and the renal failures, we are getting results with the normal medicines. Hahnemann in chronic diseases, he says that only 41 medicines are antipsychotics. And when you look the results which you got from the previous experiences, these 41 medicines are into that, the antipsychotics, because he spoke, he taught like that. And according to him, the syphilitic and psychotic miasms are only venereal miasms. But nowadays, the people are, they are changing everything. They say the cancer is a syphilitic one. But Hahnemann didn't say that. That's a problem. So I believe in Hahnemannian method, and what I'm doing is Hahnemannian. I'm getting a lot of results from that. A lot of cancer cases, because I have, when I am coming to the Netherlands, I can show that a lot of cancer cases which cured with a dose of, not a dose, it's like a sulfur, only one medicine. I'm not saying the only one dose, but if there is some chances we are getting to repeat the doses, you have to repeat that. So it's a big thing. Homeopathy is a big thing, like similimum, the dose, the potency, the repetition. So everything is very important. And when you follow the basics of homeopathy, you will get the results. Otherwise, you won't get the results, and you can't able to reciprocate it. If you believe homeopathy is a science, it should be reciprocated and it should be replicated. Yeah.
So, and I understood from Carolina that your practice is very busy. I'm not sure if you mentioned it already, but you see like 50 cases a day.
Yeah, and more than 50. Yeah.
More than 50.
Yeah, so, it's common in India. It's common in India and Kerala. Every practices like that. Not only me.
Okay. So when you come here in a few weeks, you are doing emphasis on a few topics, and I would like to mention these. So that is newborns and young children, and you also will do some issue about infertility with women, especially because we heard there are some signs that after this COVID vaccination, a certain percentage of women have fertility problems. And you will also do skin diseases. And I think you mentioned you also saw some skin diseases coming up, some skin problems coming up after COVID vaccinations. Is that correct?
Yeah. Yep. The thing I'm going to show is like that. I can show the newborn cases, I can show the infertility cases, but regarding the infertility cases, because of the COVID vaccinations, it's only a 1 year, it's a new one, so we can't able to show all the cases because we are not getting the things like that. But the vaccinations are there also for the CA cervix, that's a big thing. And I have cases from the Europe, because when I'm going there to the teach and things, people will come to me like patients. So I have some cases after the vaccinations for CA cervix, So even the newborn also, a newborn case is very, very easier when you follow the basic principles, because everything depends upon the individuality. Every newborn will be different. We can't able to specify that newborn require a particular medicine, because every newborn will be different. Some people will be very mild, some infants will be very newborn will be very mild, some will be very weeping, so we will get the symptoms from that. So it's very easier. Actually, the treating a newborn is a very, very easier thing. But you have to keep an eye on the basic principles of homeopathy. Otherwise, you can't able to cure that. And regarding the infertility also, in case of infertility, there are number of causes for an effect. Not only one cause for an effect, number of causes. So we have to get how these causes are affecting the individuality of the patient. If you are giving a vaccine, or if you are giving a medicine, or if you are taking a food, how the things are happening, how the things are reflecting in the individuality of the patient. That is very, very, very important. So what I am trying to point out is, from every cases, I am not going to teach, or I am not going to show the principles of homeopathy. I'm just going everything with the cases. I'm going to show the cases. So from each cases, I could able to ask you. It's not like a seminar thing. I would like to give a workshop. Like I would like to ask the opinion of the people who are there. I just want to discuss that,
Yeah.
because from the discussion only we could able to make them aware how the principles are working.
Yeah. I saw a few years ago when I visited your seminar here, you are working very interactive.
Yeah.
And so you wrote me already something before this interview, and you said that during the seminar or each seminar you teach case taking, and especially case taking can be adapted a bit to the pathology or to the topic, but still following the same principles. And then so how to find the symptoms, and how to translate the symptoms into the repertory, what to use, what not to use. So a lot of symptoms might appear for a regular person interesting, but homeopathically not so. And then so translating this into the repertory, and then analyzing, and then you teach us how to differentiate. So the typical things of each medicine, homeopathic medicine, how to differentiate them when they are in the analysis scoring high. So those are the topics you're going to do, and if I can repeat again, I'm not sure if I already said. So when you are coming here, you will focus a bit on newborns and young children. Then you can present some COVID cases and side effects, some infertility issues, especially with females, and also some skin diseases. And if I can say something personally, I don't have a large practice, but I get regularly people with skin diseases, and I often have a problem with that, because then I find it often difficult to get characteristic symptoms, and also from the rest of the case. So I hope you you will be able to guide us a bit in that.
Yeah. The first thing is like the skin diseases. The skin diseases are, according to Hahnemann, the skin diseases are like the exteriorization of the internal maladies. It's inside the aphorisms in the organon of medicine. So what happens with the skin diseases are like it's only the least important thing. I'm not telling about the psoriasis or something like that. I'm telling about the normal skin diseases. So what happening is like that, it's the exteriorization of the complaint. So if you treat that, if you suppress that, that will go inside. That's a problem with the skin disease. So the basic thing is you have to be cautious when you take the symptoms, because I believe in repertory. I believe in repertory. I'm using repertory since I started my clinic and I started my practice. So repertory is like, or a repertory, a radar, or something you like. A program is like garbage in and garbage out. If you are giving the bad things, you are getting the bad medicines. So you must be precise what to be taken into consideration. So if you are giving importance to the particular thing, so everything is written by Hahnemann, Kent, Stuart Close, the Bidalkers, and every stalwarts. So you have to be cautious what to be taken inside. So what I am doing is like that. What I did before 1 month, I was in Madrid in April. So there it was like a homeopathic group who they have been practicing like a lot of years and all. So we did a workshop. They brought patients. So we took the case. What we did is like we took the case. After case taking, we discussed what to be taken and how to repertorize and how to come to the medicine, like that. So I think this audience, I think this is not like this. This is a conglomerate. It's like a lot of patients, a lot of audience are there, students, masters, principals, like that. So I can't able to tell like that. But even though I can show the cases, I can describe the cases. Even though I will do something like an exercise. I will give the case sheets and ask them to solve the cases. So that's why I could able to teach them what to be taken from the case, what rubrics to be taken, and what intensity to be given, and all. And from the medicines coming out from the repertorization, the potential differential field, it's like more than 5 medicine or 6 medicine, how to arrive to the particular medicine, what things you to be cautious regarding taking a medicine. So that is the thing what I am planning. And as you know, the thing is like how the people are interacting, I can go to that level. That's all.
Yeah. So when I post this interview, I will put at the bottom a link to the seminar details, a website. We made a website where people can read the seminar details, and I will put a link to your Facebook. So we hope some more. The room is big enough, so I hope some more want to participate.
I believe I believe that even the homeopathy originated from the Europe, and when you look into the present scenario of homeopathy in the Europe, it's the people are they're getting away from homeopathy only because of the fact that they are not following the basic principles. But here in India and here in Kerala, the state in India which I belong to, here we are following the basic principles. That's why we are having patients and we are able to cure them. So I believe in a system. I believe in a system which which could be replicated. What I am doing here in the Kerala, you could able to replicate there. You could able to get the results from there also. That is the science which I am believing. So what happened to the Western world? Because it was flourished, homeopathy originated and homeopathy flourished in Europe and in US also. But what happened after that? People says that it is because of we are not getting the insurance and all. It is not like that. If you are getting the results, here also we are not having insurance, because even though the people are having the government dispensaries and all, when we compare to the United Arab Emirates, the UAE, the Dubai and Abu Dhabi, homeopathy is flourished there. They are having insurance now because they know the homeopathy is working. That's why the insurance is also allocated there. It's expensive there, but the insurance is there. So what happens is like that. If you can show the results, then the people will come. For that, you have to follow the basic knowledge, the basics. If you are not in the basics, you can't able to flourish, because handyman invented homeopathy, not the masters who came afterwards. Handyman. After the 250 or more than that years, homeopathy is still here in the world only because of it is helping the humanity. That's why homeopathy is flourishing. During this pandemic, how homeopathy flourishes all over the world, because of this, the principle. We were fearless. I've been treating more than 50 COVID cases every day during the 2020 and 2021 without wearing a mask, and without vaccination. How was I able to treat that patient? Because of philosophy. I know the philosophy. That's why I was able to treat the patient. Not only the acute cases, but the people who were having less than 90 oxygen saturation. We treated with them with the Chininamars, arsenicum alb, China, because everything written in homeopathy, everything written by Hahnemann. So just follow the basic principles of homeopathy, you will get the results. If you are behind the lesser known remedies or the small remedies, you can't able to reciprocate, because the masters are telling all these things, and if you can't able to reciprocate, what is the reason? So just give importance for the Hahnemann. Hahnemann was the founder, and he invented and he wrote a big catalog, big catalog. You just read that and follow that, you will get the results. Okay. I can assure only one thing, that I am not going to tell you the philosophies or the principles or something like that. I am going to show the cases. The cases, only the cases, and how I dealt with the cases and how I got the results. And I will explain the science behind that. That's all.
Yeah, yeah, yeah. Yes, that's what I saw you were doing a few years ago when I visited your seminar. So without taking your repertoire and the materia medica with you, you cannot follow
It's a must. Yeah, yeah, laboratories
yeah,
must.
you're
Laboratories
very,
must.
very interactive, and you challenge the audience very much. Okay, Dr. Veneeth. So I'm looking forward to your seminar here in the Netherlands in that's the 10th and 11th June.
Yeah.
And I mention again, I will put below in the subscription, in the, how do you call it, in the subtitles of the video, the link to the website. And we hope some people also from abroad will come. And I'm looking forward to it. And thank you for this interview.
Yeah, thank you, Rene. Thank you. Take care. Bye.
Bye.